Welcome to Understanding Migraine, a series of short videos for healthcare. We'd like to thank the HSC National Lottery offices in CHO Area 2, Galway, for this event. In this episode, we hear from Dr. Alison Byrne, Clinical Psychologist, Cares Towards Self Care and Headache Management Migraine Service at Galway University. Alison will look at the place of psychology in migraine management and at the referral pathways for nurse. If you'd like more information on this video or on our services, please email info@ie. Dr. Byrne, thank you very much for being with us today.
You're welcome, Deirdre. Lovely to be with you. So I'm going to talk today about a few different areas here. So I'll give a very brief overview and prevalence of migraine in Ireland. I'll talk about the referral pathway for my post. Then some psychological assessments for patients with migraine. I'll talk about how psychology can help with migraine and about how understanding chronic pain can be helpful for psychologists working with people with migraine as well as other type of head pain and pain in general, really. I'll say something about psychological approaches for chronic pain, and that will kind of finish us up for today. Okay, so just to say that migraine is a complex neurological condition. It's common, but it's invisible and spans a person's life. The invisibility of it can be very difficult for people, and that can be something that takes up some focus in psychology, in therapy with people. The idea that it can be so debilitating to have a migraine or other form of head pain, and yet others can't see the extent to which it's impacting on their life. The World Health Organization describes migraine as the second most disabling disease worldwide and the first for under 50s. And it often begins in puberty and mostly affects people aged between 35 and 55 years. There are 600,000 migraineurs in Ireland and indeed 41 million in Europe, so huge numbers affected. The disease is 3 times more common in women, so it has a hormonal component, and it affects 10% of children. And so on any given day in Ireland, 13,000 people are suffering from migraine, which is really very substantial. And so really important for health professionals to understand and know the sorts of things that might come up in therapy and trying to support people. So in the service that I'm in, it's in the neurology department in Galway, and this service for migraine was created as a pilot project to help address the needs of people with migraine, which of course includes their psychological needs. It's a Sláintecare pilot project. It was instigated by a team coordinated by Professor Orla Hardiman, and it was called Towards Self Care in Headache Management. It's currently in operation in Galway University Hospital, St. James's Hospital and Tallaght Hospitals, and it's been approved for rollout nationally on a permanent basis, which is excellent. So a person attending the neurology department because they experience migraine, chronic daily headache or associated head pain will likely have a consultation with a doctor. There's also a clinical nurse specialist employed as part of this self-management project who the person with migraine is likely to meet. And it's typically either of these professionals who identify the person's need for psychology. So for the Galway service, I created a brief questionnaire for which the doctor or nurse can ask a person to complete to help identify the degree to which stress plays a role in the person's life and the degree to which they view stress as a contributing factor to their head pain. And then where a person indicates that stress plays a role and that they're interested in psychology, I follow up with that person. So the person will then be either waitlisted for therapy, signposted to psychoeducation and informed about the Migraine Association of Ireland so that the person knows where they can access help. Now, in terms of psychological assessment for patients or people with migraine, an assessment primarily involves the typical history taking that psychologists will be very familiar with, that includes the person's current symptoms and functioning, and importantly, their development from childhood to explore how attachments and experiences in these early days may have contributed to the development of chronic pain via disruption to the functioning of the nervous system. There are a range of specific measures that may be useful to ask a person to complete, not only to measure the efficacy of your intervention, but to open the conversation to explore further about the person's experience and the impact of head pain on their daily functioning. So I've just put up a few suggestions here. So for example, the Headache Disability Index. This explores the extent to which head pain interferes with the person's life. We've got the Headache Self-Efficacy Scale, which helps to measure any change in the way a person might feel about being able to manage their symptoms. The Brief Pain Inventory, the short form of this, measures pain interference and pain severity. And then something like a HADS, the Hospital Anxiety and Depression Scale, or the Patient Health Questionnaire, will give you a good idea of just how the person is functioning with regard to their mental health. But when using any questionnaire as a pre and post intervention measure, it's helpful to keep in mind what you want to measure. So for example, your intervention may not result in reduced pain, but rather better ability to cope with pain. And so choosing a questionnaire that measures what your intervention is aiming to change or improve is just something to consider. And I think the ones here that I've mentioned are freely available online. You can just Google them. And there may be times when a personality assessment measure such as the Millon is useful to contribute to the clinical picture. And there have also been some times when I've used something like the PTSD Civilian Checklist or the Trauma Symptom Inventory when the person's background indicates that trauma has been part of their experience. So in terms of the role for psychology, I mean, it's things that psychologists may be very familiar with. So helping to explore migraine and head pain, helping to explore the triggers. So the triggers may be triggers within the environment and lifestyle factors, but it's likely that the clinical nurse specialist or the neurologist or doctor who has met the person to start with may have already covered these sorts of environmental and lifestyle triggers. So when it comes to psychology, we might be interested in current relationships and ways in which difficulties here and triggers for migraine may link back in time to earlier relationships and experiences. And I think this is something that can surprise people with migraine or head pain, that relationships and expectations and roles within relationships can be significant sources of stress that can contribute to migraine. So another key role here is providing psychoeducation about the relationship between stress and pain, including the role of the autonomic nervous system, thoughts, feelings, and behavior. And then learning about how this information can support the management of pain and introduction of management strategies. Therapy is also, or psychology is obviously very important for providing a therapeutic space where people can reflect on their lives, including things they struggle with a view to gaining insights and informing their future behavior. And then for migraine, groups can be very helpful, both for the psychoeducational aspects and also the peer support. And then we can also provide links to helpful resources. So in terms of psychologists watching this recording, I think it might be very helpful for health professionals to have some information about migraine and chronic pain more generally. And there are some excellent resources available online. So for example, this video called Calm the Storm helps explain the development of a migraine from prodrome or early warning signs to full impact to post-migraine symptoms, which is called the migraine hangover. So this video can be found on neurosymptoms.org, and I think might be quite informative for people to watch. There's another website called migrainedisorders.org, which is an excellent suite of videos for helping to explain different sorts of migraine and headache. That might be another useful place to go to. And I want to mention that there's perhaps a less well-known aspect of migraine, which is called migraine aura. And it's experienced by a percentage of people. It can include symptoms such as pins and needles, numbness, aphasic-like inability to speak or find words, the experience of tunnel vision, and nausea and vomiting can also be part of the presentation. And these symptoms, alongside the intensity of the pain, can be very debilitating, distressing, and frightening for people. So helping provide a place for people to talk about the worry that can be involved in these sorts of symptoms is another role for psychology, and helpful for the psychologist to know about. There are some very helpful, there's many written resources, but some ones that I have used in the work include this book by Alan Gordon called The Way Out, which is a book for people with chronic pain more widely, but it's based on the premise that chronic pain is the result of the brain's sensitized processing of sensations that arises out of repeated learning of the pain pathway and receiving sensations as threat signals. So from a psychological perspective, these threat signals can equally stem from emotional as much as physical distress. And that book has been something that I have recommended to people, and I've used an exercise from it, which is called somatic tracking, which I'll come to a little bit later. The pain management workbook is also helpful in taking the reader through exercises to help manage pain. That's by Rachel Zofnas. And then there's the book called Splitting, which is of interest in that it goes into detail about different sorts of head pain and has a helpful chapter on the link with stress. There are also some helpful and entertaining experts on pain online via YouTube that are also good sources of information. So in particular, Howard Schubner and Lorimer Mosley, they're quite good sources of information. And then of course, the Migraine Association of Ireland here has an excellent bank of resources informing about the wide range of head pain diagnoses, and in particularly that can be useful for people with a more specific form of migraine that you might want to read up around. And then also just to mention that I created a video mini-series on chronic pain for people attending the service. And I think it might be helpful for colleagues as it talks about different pathways to pain from a psychological perspective. So this mini-series will be soon available on the Galway University Hospital website on the psychology page there, which is currently in development. And today is the 19th of December 2022. So by the time you're watching this, it's likely to be available, or hopefully it will be available there on the Galway website. So just for psychologists watching now here today, I'd like to talk about the sorts of psychoeducation that I might provide to people attending the service. And I think it might be helpful for you to just be aware of 5 different pathways to pain that are relevant from a psychology perspective. So the first one is with regard to the functioning of blood vessels. So very briefly, blood vessels grow wider and more narrow in response to activity in the body. So when they widen or dilate quite a bit, they hit off pain receptors in the blood vessel walls, which send a signal to the brain, which processes pain. Now, stress influences blood vessel functioning via the autonomic nervous system and other ways, such as the food and drink we take when we're stressed. And then how hydrated a person is also influences blood vessel functioning, as hydration helps the bloodstream to flow more easily and maintain regular vessel wall width. So in terms of just how and why management of stress can help a person's migraine, that's one of the areas. The second pathway that I talk about is with relation to keeping the autonomic nervous system in balance or regulated. And this incorporates ideas for stress management. And I might often record a relaxation practice we'd carry out in the session so that the person can listen back in their own time. I might get them to record it on their phone or something like that. So to actively help them to have ways to regulate their own nervous system. A third pathway to pain is a very interesting one in relating to how the brain processes pain and how this gives rise to what we call neuroplastic pain. So briefly, there are three types of pain that we tend to experience. So the first is neuropathic. It's to do with pain from damaged nerves. Then there's nociceptive, which is to do with pain from damaged tissue, including muscles and tendons or joints. And then we have this third, neuroplastic pain. And this is to do with pain arising from the brain becoming sensitized to pain signals. So as psychologists, we tend to think of both emotional pain as well as physical pain. And when a person has been experiencing pain in either realm from as early as childhood, then the brain becomes very practiced at processing distress as signals of threat and consequently pain. For anyone who's interested, there's an interesting video on YouTube called The Mysterious Science of Pain, and that goes into more detail about neuroplastic pain. And also in that video series I made that I mentioned, I go into some detail about what's called the gate control theory of pain, which helps us understand how the body is equipped with its own pain relief system and clever ways in which particular aspects of the nervous system have the capacity to block sensations from entering the spinal cord and brain, and so cannot be processed as pain. But for now, the sorts of things that can activate these inhibitory interneurons, as they're called, are competing non-painful stimuli, such as doing a pleasant activity, meditating, chatting with a friend, any activity that competes with the pain sensation. But of course, this is only true for the early stages of pain, so helping people to recognize their early warning signs can make all the difference and can help medication taken at that point to be more effective. So a fourth pathway to pain that I talk about with people who I see with migraine is thoughts and feelings and how these impact on bodily sensations and behavior and subsequently on pain. And that's something that's going to be very familiar to you, I imagine. And then the fifth pathway that I talk about is via relationships, which brings in early attachments, patterns that get repeated and roles that get played out to maintain a cycle of distress and pain. So just to say something now about working therapeutically, sort of approaches that we might use. So when working therapeutically with a person with migraine, your own preference for a particular approach is relevant once it helps the person to make links between what happens in their mind, brain, and body, and between what happens internally and externally in their relationships with others and their behavior. And just to say that when I started out in this post, I carried out a literature review on the topic of psychology and migraine, which includes research on psychological interventions in the area of migraine. And I made notes from various articles. So if anyone wishes to receive these notes, they can email the Migraine Association of Ireland and I can pass these on. So just to mention a couple of notes from that, the research tends to be carried out for cognitive approaches, including cognitive behavior therapy and acceptance and commitment therapy, and also mindfulness-based stress reduction. And they've all been shown to reduce headache-related disability and emotional distress, with the usual sort of provisos on maybe lower quality of the studies. And then EMDR, also another approach, eye movement desensitization and reprocessing therapy. It has a specific migraine protocol, but just from experience clinically, EMDR, the usual protocol, can be quite helpful and incorporates a focus on the body and resourcing exercises for pain. And then my first note there in terms of the container function. So in psychoanalytic theory, Bion hypothesized a theory on the development of thinking and emotional growth, initially in the infant-carer relationship, but which then creates a template for future relating with others. So briefly, the carer helps the infant make sense of their distress, which is what he described as the container function, and the infant thus experiences being contained. Then in the absence of this sense-making, distress builds without having words put on it or meaning made of it. And so in Bion's theory, this interrupts the ability to think about and express painful experiences. And indeed, the distress can enter the body where it is experienced physically. So therapy can help a person to explore their experience of being contained in their relationships, and can help people to put words on their distress and express intense emotions associated with their experiences. These intense emotions may include those that society doesn't typically welcome or allow, such as anger and aggression or deep sadness and loss. Now, of course, the person will bring their own level of resilience and coping, and so therapy is also about helping to develop and expand these for living with pain. As always, there's no shortcut to therapy. There are certain changes people can make, of course, in their lives based on psychoeducation and a briefer intervention. But then there are aspects of the self that need time and space to be explored and developed. Those beliefs, for example, about the world and ways of being with others that may well be keeping the pain going. So I'll just finish up now with a few resources that I found that can be helpful or that may suit your own personal preference for therapy. So this first one here, the somatic tracking exercise, which you can just Google online, is from Alan Gordon's study on people with chronic pain. And it helps, this exercise helps people give feedback to their brain that although the pain is unwanted, it's not harming them, it's not dangerous. So that can be a nice one to do with people you're seeing in clinic, and encouraging them, maybe giving them this handout, encouraging them to do it themselves. For people who like ACT, there's a book on acceptance and commitment therapy for chronic pain. I also came across or was actually told by somebody I was seeing with migraine about this person called Vidimala Birch, who lives with chronic pain from spinal injuries, and she's a mindfulness practitioner with resources on her website that might be useful. So again, you can just Google her name and her website will come up. And she also has a website called Breathworks, which is mindfulness, and she's got some practices on there. And then for anyone who likes the somatic experiencing approach, Peter Levine certainly has books on pain, including this one called Freedom from Pain. So that's the sort of thoughts I had around speaking to psychologists about the work with migraine. Likely that there'll be a good bit here that's quite familiar to you, and so perhaps will encourage you that you don't need extra special skills or anything for working with people with migraine. So perhaps back to you now, Deirdre, there.
Thanks a million, Alison. That was excellent. This video will be available to care professionals on our website, www.migraine.ie/HCP. If you have any comments or questions about this video or how to get a certificate of PD points, please contact us at info@migraine.ie. Thank you for joining us today and this video informative.